guys, Heather here. So have you ever had a patient who doesn't want to use their call light or wants to do everything by themselves and then gets themselves into big trouble? I understand it's important to want to keep your independence, but sometimes we just can't do things by ourselves. I really hope that I'm not one of those ladies who doesn't want to use her walker and then trips over something and falls and breaks her hip. I mean, I don't blame these people for not wanting to use their walker, because who wants to walk around with a dorky walker? But in perspective, walking around with a walker is better than hip surgery, right? So when I first started nursing, I had a patient who had hip surgery, and one morning she decided to not use her call light and get out of bed and use the restroom. Can you imagine that? A post-surgical hip patient getting out of bed by themselves? It's not going to turn out good. So I heard her yell coming from her room, and there she was, on the floor. We had some x-rays done, and guess what? Her other hip was fractured. She was usually compliant from what I remember, but I guess that morning she was feeling a little impulsive and decided to help herself to the hospital room floor. Another patient just had his Foley removed, and I told him to call me if he needed help using the urinal because he was 91 years old and just had hip surgery, so he might need help with that. The next thing I know, he calls me to the room and tells me he spills his urine all over himself. So I told him next time to use his call light and we can come help him use the urinal, and he's like, when I gotta go quick. So he continued to use the urinal by himself and spill it all over his bed, and we had to change the bed multiple times. I'm not sure why he continued to try and use the urinal himself, but we ended up putting a brief and a bunch of chucks underneath them. On the other end, I had a patient who was ambulatory in his 50s and could definitely do things by himself, but for some reason, he wanted me to help him with everything. So this patient also had his Foley removed in the morning, and he had the audacity to ask me if I could help him use the urinal. I mean, what did he want me to help him with that he couldn't do himself? Nice try, buddy. What kind of nurse do you think I am? So there are patients that don't like to use their call light when they need help, and patients that abuse the call light and ask for things when they don't really need help. That's just the way it is. So sometimes I have to put call light abusers on call light restriction, and I tell them you have 3 chances to use your call light during the shift, and that's it, so use it wisely. Just kidding, I wouldn't really do that. Well, not every shift anyways. Well guys, thanks for supporting the Nurse Channel and have a great week. I'll talk to you soon, okay? Bye!